and welcome to Dragon Bites, the paediatric podcast aimed at paediatric trainees or anyone interested in child health. My name's Dr. Stacey Harris and I'm one of the founders of Dragon Bites. Today we have one of our career pods. These are podcasts aimed at helping trainees apply and interview for grid specialties. This week it's community grid training. And I had the pleasure of joining Dr. Lizzie Nickerson, who is a community paediatric consultant, and Dr. Emily Shand, who has recently completed the grid application process and is about to start community grid training in September, and Siwan Lloyd, who is also a paediatric trainee who has also recently completed grid application process and is about to start the grid training programme in September as well. Hi everybody, I wanted to start off by getting to know you a little bit more. I wondered if Siwan could start us off by talking about her medical career to date.
Yes, of course. So hi Stacey, thank you for having us on the show. I am currently an ST5 paediatric trainee. So I started off my medical career, going to university in Edinburgh, and while I was up there, really developed an interest in paediatrics and also in neurology, intercalated up there in neuroscience, and then graduated from medical school and came back down to Wales, where I was from, to work as a foundation doctor. At that point, I knew I was going to do paediatrics, so I applied for my first job to be in paediatrics and was very lucky to be able to start paediatrics in UHW, in the University Hospital of Wales, with the amazing team there, and really enjoyed that. Then I finished my foundation training in and around Cardiff and Newport, and then applied straight away to go into run through paediatric specialty training, which I then again started in the Wales Deanery 5 years ago now.
Siwan, I know loads of things I didn't know about you then. That's exciting.
Is it? That's good. Yeah.
Yeah. What made you choose paediatrics?
I've always wanted to do paediatrics, even since before medical school, really. I grew up with a brother who has got Down syndrome and also had a stroke when he was about 11 years old. So I was about 10, and he was in hospital for quite a long time then. So I think I just had quite a lot of exposure to medical professionals and paediatricians when I was a young girl, and also other members of the multidisciplinary team that helped him. And yeah, it was all just very inspiring. And I think children's wards are just lovely and bright and beautiful, and the emphasis is really on making children, making the experience as pain-free as possible, and everyone's very friendly, and it's a lovely environment to work in. So I always knew, even before going to medical school, that I wanted to do paediatrics.
Well, that's a lovely story, Siwan. Emily?
Yes, hello.
Hi. A little about your medical career so far.
Yeah, so I went to Cardiff University to study medicine. I did a BSc in psychological medicine halfway through, and I qualified in 2008. Did my F1 and F2 jobs in South Wales, and I actually did paediatrics in both of those years, and really enjoyed them. But I hadn't quite made up my mind about what I wanted to do for my future training. Although I did really enjoy peds, I kind of was thinking about GP or psychiatry. Actually, I quite liked CAMS. So my husband and I went off to New Zealand for a year, and I did general sort of house officer level jobs in a small district general hospital in New Zealand, which was the most fantastic year. So then during that time I applied for paediatrics, started in Wales, paediatric training in 2011. And we started in North Wales, so I did 2 years in North Wales before coming back down to South Wales. I've had quite a few maternity leaves during my time, so I've worked less than full time since 2013. And I feel like I'm a bit of a forever trainee. There are a few of us around. Yeah, I'm ST5 now, just finishing ST5 and hopefully starting in September for community grid.
Awesome. So what made you choose paediatrics?
So I loved my 4th-year placement. I worked in Merthyr, met some really inspiring registrars there, and I think I just felt like I'd found my place. I found something that I just really enjoyed. And then I must say I was somebody who thought hard about not doing paediatrics rather than the other way around. So I wasn't quite sure that I wanted to do such a long training program, knowing that acute paediatricians often have quite an intense on-call rota. I wasn't really sure that I wanted to do that when I was sort of doing my F1 and F2 jobs, which is why I kind of took the time to think about it whilst we were away. But ultimately, I followed my heart, and paediatrics is what I love, and I wouldn't be without it. It's definitely always what I enjoyed doing. So I am someone who's had a few blips in my training where I've thought about not carrying on to be a consultant, but I've never thought about not doing paediatrics since I've been on the run-through programme. It's always been peds. It's just whether I wanted to get through to the end to be a consultant. But I pushed through, and I feel like I'm over the hump. The end is in sight, even if it is 5 years away.
Yeah, I'm all for following your heart, Emily. That was nice to hear. Thank you. So, Lizzie?
It's so interesting hearing about everybody's
Hi, Lizzie.
career.
I know, isn't it? It's absolutely lovely. Yeah, and we've known each other for quite a long time, all of us. And yeah, there's just some things you just never ask someone. So can you tell us a little about your career to date, Lizzie?
Yes. So I moved to Cardiff to university, and then have been stuck in Wales ever since. But I'm very glad that I am, because it's a great place to be. So I just had a very normal sort of university. Didn't do anything as glamorous as Siwan and Emily. Didn't intercalate. Then did my foundation year 1 up in North Wales, and had a great time. Had a little blip about, do I want to do paediatrics or do I want to do GP, because most of my friends were going to do GP, and a bit like what Emily said, I thought, oh my goodness, what am I putting myself through, so many years compared to my friends who will be done and dusted within the 3 years. But I'm very glad that I did, as Emily said, really go with my heart and stick with paediatrics, because I have loved it. So then I applied for paediatrics, did a lot of my early training in Cardiff, which was brilliant, and then applied for Community Grid. I decided to apply for Community Grid really because my ST1 post was in community. I was quite lucky to have that early exposure to it, and it sort of ignited something within me, and then I pursued that, and sort of got extra experience here and there. And the more experience and exposure I got to community, I realised that it was the thing that sort of, to sound a bit cheesy, made my heart sing. And so then I applied for Grid. I was in the first batch of trainees to apply for Community Grid, because it's a relatively new Grid programme. Did that Grid training in South East Wales, and then became a community paediatric consultant in September of last year in Nevill Hall in Abergavenny, which is brilliant.
So are you enjoying your job so far?
It's brilliant. It's everything that I wanted it to be, really. And I think as you get further through your training, you realise that you have to choose something that you can see yourself doing for the rest of your life, because I've enjoyed every part of paediatrics that I've done. I've enjoyed the subspecialties, I've enjoyed neonates, and I've enjoyed general paediatrics. So it wasn't an easy decision in that way for me, but it was just the one that sort of clicked and made the most sense, and what I could see my brain still being interested in 10, 20 years time, because as you know, Stacey, because I never stop harping on about it, it's such an evolving specialty, and I find it so fascinating. all the time. It's constantly challenging.
So why did you choose paediatrics?
Right, I always knew I wanted to work with children. I come from a family of teachers, so I'm the first even vaguely medical person in my family. But I knew I didn't want to stay in school for the rest of my life. So then somebody suggested medicine, and I thought, oh, how can I combine medicine with wanting to work with children? And obviously it's a no-brainer to do paediatrics. But then I think I've enjoyed lots of different things. So through medical school, when you do your different placements, I thought, oh, maybe I'd do this, maybe I'll do that. But I always came back to paediatrics in the end.
Yeah, paediatrics is amazing. I can't imagine doing anything else either. So you all have talked about why you wanted to do community. Was there anything that you haven't said that you wanted to sort of add at this point about why a trainee should choose to do community?
But I think that we have to talk about the work-life balance, because it's brilliant, essentially. I myself get frustrated when people think that we only choose community because of the work-life balance, because that isn't the reason for most people, but it has to be talked about, and it is something that is important for a lot of people. So a lot of my friends chose GP because they thought it had a good work-life balance, but I think if you asked a lot of them now, many years on into their career, they might feel a little differently, because actually there's such a huge time pressure really on GPs, and where I think I'm very lucky in my consultant job that I can pretty much always clock off at 5 o'clock. So it is genuinely a 9 to 5 job, as long as you are organised with your time. Whereas, and obviously I don't have any nights or weekends, which is brilliant. And I'm still very much in the honeymoon period of enjoying that, having just become a consultant. For GP, for example, it isn't a genuine 9 to 5 job by any means. They work much longer hours on weekdays and often have to do weekends as well. So I think that's definitely something to consider, and especially for people like myself who've got a young family, it does make work more enjoyable because you can enjoy your work-life balance. But I think there's also so many reasons to choose it. If you're the kind of person who likes to get involved in, I guess, the bigger picture, by which I mean public health. So rather than just having an effect on that one patient in front of you, having an effect on a whole population is phenomenal, really. And obviously you have loads of opportunities to get involved in that through doing community. There's a lot of management potential as well. So if you're the kind of trainee that's enjoyed management and leadership through your trainee years, there's a lot of potential for promotion, and also because the job can be a little more flexible and you can adapt it because you haven't got the acute on calls to fit in. I've found generally in my limited experience that there's more potential for that. I think the other thing is, if you're the kind of person who likes things that are grey, so not black and white, then community's for you. So I love that sort of being presented with uncertainty and then having to draw together lots of different opinions, lots of different results, and with an evidence base, trying to get through to the root cause of the issues, really, and find out what is actually causing this child's presentation. That's sort of what clicks for me, and I think you have to have a particular kind of mindset to enjoy that. Many people hate that, and they would much rather have a patient present to them who has a particular list of symptoms, and then you do a certain set of investigations and get results, and then know what the management strategy is going to be. Whereas that's not, if you like that kind of patient, community is probably not for you.
I think, as Lizzie said, working together as a team is very much a part of community paediatrics, and you use your other team members to help you clarify things in some ways. So as Lizzie said, you get presented a grey, complex patient, and you've got to kind of figure things out. But you're not doing that by yourself. You're doing that with a team of different people, different agencies, and sort of having to communicate with them all. I think that's what I really enjoy about Community Paediatrician particularly, is that communication across the different agencies and amongst your team members. Really,
there's a lot of thinking outside the box as well, and it often makes me think of sort of, you know, being a bit like a lawyer in court, really, because you're bringing together lots of different evidence, as Emily said, from different agencies, from different people, and trying to make sense of it all, and that's quite rewarding, really.
Siwan, what was it that drew you to Community Paediatrics?
Well, it was a bit of a difficult decision, really. So it was a very last minute decision as well. Kind of the night before a job needed to be accepted, kind of decision. So I all along I've always known the kind of patients that I enjoy working with. So I've always had an interest in any child with sort of complex, chronic, long-term conditions, children where you have to think very holistically about managing their participation and quality of life, and it's not just about, you know, curing a child of a particular disease and that's the end of your relationship with them. I've always enjoyed sort of seeing children throughout their lives and helping them with lots of different elements of their lives, and thinking about education and the social context, and thinking about family and continuity of care. And I've always enjoyed, so the jobs I've done, I've very much enjoyed working with the types of patients that we've seen in sort of pediatric neurology, neurodisability, palliative care, children where they've got lots of different things going on, lots of different teams involved, and then being part of that team and coordinating the care. Along with that, I'd always sort of flitted back and forth between thinking I was going to apply for either pediatric neurology or pediatric neurodisability or pediatric community child health. It was quite a difficult decision because I've really enjoyed all of those elements, and I think that I would enjoy working in any one of those career paths. And in the end, it very much came down to, so I applied then for both, I applied for community child health and neurodisability grid training, and thinking I'd be very, very happy accepting either of those jobs. Didn't really think about what I would do if I got offered both of them, and then was very lucky that I had the choice then at the end. And it was lovely. I spoke to lots of different people who work in the different areas for their advice, and really at the end it came down to thinking about what sort of consultant job I could see myself doing you know, in the future, and what my priorities were, and I looked through the curriculums to see the differences between them, and really I sort of felt that community, in terms of where I want to end up working as a paediatrician in South Wales and the sort of work I'd like to be doing, I felt that community offered a lot more opportunities and more flexibility in terms of getting the training that to end up where I want to end up, which is sort of working in the community and seeing a wide variety of different children. I don't really see myself as a sort of tertiary specialist who sees children and gives advice and then they go back to their local teams. I very much want to be part of that local team. So really it was just thinking about where I want to end up and the type of job that I want at the end of it.
It's so great hearing you three talking about community paediatrics. Lizzie?
Yes.
What is the most rewarding part of your job?
Yeah, so I think it's such a tricky question, isn't it? But I think if I had to sort of put it in a nutshell, it would be being the child's advocate. Now, I'm sure, you know, obviously we do that in whatever element of paediatrics we're in, but I feel that we do it to our best ability, and sort of it's demanded most of us in community paediatrics. And I think that's across the sort of 4 parts really of community paediatrics. So thinking about your children within neurodisability or neurodevelopment or safeguarding or public health, it's always about being that child advocate. And that's rewarding because, for example, if we think about neurodevelopmental patients like your child with ADHD, when you get the diagnosis right and you medicate them if necessary, and you see that child come back into your clinic room having previously had absolutely no self-esteem, being labelled as the naughty child, thinking that they're no good at all, to coming into your clinic room and telling you that they won star of the week that week, and look at this piece of work that I've done, Dr. Nickerson, and all this kind of stuff. It still makes me well up just thinking about it, because it's just so wonderful seeing a child full of self-belief and self-esteem and potential that's been previously sort of unrecognised. So that's an example in neurodevelopment. And then in safeguarding, which I know a lot of people fear that word and fear having to do child protection medicals, but actually being that child's advocate and getting that story and that report as accurate as you can is an incredibly rewarding experience, because ultimately the outcome of that should be the best for the child. And it's sort of getting through the weeds and all the complications of all the adults that are in their life, and getting through to what actually is happening for that child and what needs to happen to enable them to thrive. So yeah, I think that is probably the most rewarding part of my job.
You had me bellying up then. Emily and Siwan, I know you haven't quite started the job. Did you want to, is there anything about sort of the rewarding part of the job that you wanted to add there?
I think Lizzie's probably summed up what I feel about community. I mean, I've just finished doing a year's worth of community paediatrics in Neath, Port Talbot and Swansea. And I think that message of advocacy for the child was something that that I really, really enjoyed and got a sense of pride from. So, and even when I'm working on the ward, being able to listen to the child, listen to the families, and be able to have the time to involve them in decision making and things. And it is part of all paediatric jobs, but I think, as Lizzie said, it feels even more important, even more of a role in community child health.
I completely agree. I think it's a privilege really to get to know children and families and community, and to see them grow and develop and thrive, and go through the difficult times with them and support them through that, but then also be able to celebrate good times with them as well. I think the way Lizzie described that was really lovely.
Should we talk a little bit more about community grid training? So what does it actually involve? Siwan, do you want to start?
So my understanding of it, obviously I haven't started yet, is that you do 2 years in community child health settings, and then that your third year is a bit more flexible, and then you can choose to sort of pursue an area of special interest. So this is one of the reasons that I was saying when I was deciding between neurodisability and community, this is one of the things I really liked about community, because the neurodisability was a bit more rigid, what you had to do in your 3 years, whereas in community it gives the opportunity to, maybe if you're interested, do 6 months of palliative care, or 6 months of neurology, or 6 months of CAMS, and to sort of really direct that last year of training towards your subspecialty interests, which I'm quite looking forward to. In terms of what you do, I guess Lizzie would probably be the best person to talk us through all the different areas of training, but I think it's really very variable from what I am expecting and from what I've done in my previous jobs, from, as Lizzie was saying, neurodevelopmental assessments, seeing children with suspected autistic spectrum disorders, ADHD, seeing children with neurodisability, children who are in care, so looked after children, doing safeguarding, public health, educational paediatrics. There's so many different elements, so it's nice and varied, and you can really find your own little niche amongst that, really.
From my experience of grid training, very much like what you said, Siwan, it's I really enjoyed the flexibility of it. I think the strict guidance is that you're supposed to do 2 years in community, sort of generic, and then you have that extra year where you can do something else, allied specialties. But you don't, just something to bear in mind as well, you don't have to, it's not completely time limited, so you don't have to do the 3 full years. So many people will finish 6 months early, as long as everything is going well, and obviously you're having satisfactory ARCP outcomes. so if I say what I did, so I did 2 years. Did I do 2 years? I think I did just under 2 years in generic community, because I finished 6 months early, and my year then of other specialties, I wasn't particularly drawn to palliative or neurology. So I organised to do genetics, and some public health as well, which were brilliant, and I'd really recommend them to anybody who's doing grid training, because very easy to organise. So particularly if you're based in Cardiff, obviously there's an excellent genetics department in Cardiff, who have paediatric specialists within genetics, and they are very welcoming, and that was a very, very useful and rewarding time to spend with them, particularly to know how they manage the array CGH results, and how they manage a child who's query syndromal, so fascinating to see how their formulation works. And then I really enjoyed my public health time, which I did with Dr. A.D. Norton. I would have loved to do more, and I hope to do more in my future career, but I think that's pretty much a mandatory part of community training, certainly in Wales now, because it's so beneficial, and it gives you such a huge insight into how, in particular in Wales, we work as a country, and we work so closely in healthcare with the Welsh Assembly, and actually the influence that we can have as paediatricians, which is so important. And then I did CAMS as well. So CAMS is one of the already recognised specialties, and I would say, an absolute must, because there is so much overlap with the work that CAMS do nowadays in community paediatrics. So in particular, the neurodevelopmental conditions, but also the overlap with depression, anxiety. I get asked about those kinds of symptoms every clinic, basically, because there's so much overlap with the patients that I see. That's what grid training involves. And then, so I can only really talk about the Wales training, but I suspect it's very much reflected across the UK, in that depending where you are, you get a different experience of community paediatrics. So, for example, in South Wales, if you work in Cardiff, you will get a load of exposure to patients with ADHD, because essentially community paediatrics see most of the patients who have ADHD even up through their teens in Cardiff. Whereas if you worked in a different place in South Wales, you wouldn't get so much ADHD exposure, because that caseload tends to be with the neurodevelopmental team who sit in CAMS. So that's important if you're thinking about applying to different areas, to think about what areas you might want to apply to, because their caseload will be heavy in different areas, and you want to obviously go somewhere that has a caseload heavy in what you think you're going to enjoy.
Listening to Lizzie talk, she's kind of made me want to do a bit of community, make my community paediatrics go on for much longer, because you've just mentioned like all the different subspecialties that you could possibly do, and I'm like, yeah, that sounds quite good, quite enjoy that. That would be quite good to have behind me. So thanks for making it even harder.
So it's 2.5 years to 3 years, and can you extend it as well if you wanted to?
Yeah, so out of program, so strictly when you're on grid, you can't go out of program unless you've got permission from the head of school. And normally, if it's something very beneficial, I think they will give you permission. But yeah, strictly speaking, you're not supposed to.
So is there any specific requirements that you have to have by the end of your grid training?
I presume you mean from a sort of syllabus point of view, do you?
Yeah, I think so, yeah.
Yeah. So obviously, with the new progress curriculum, you've got the generic outcomes that you have across whatever specialty you're doing. But then for level 3 community child health trainees, there's 5 quite general, really extra outcomes that you have to have achieved. So they are demonstrates proficiency in the paediatric assessment and management of vulnerable children, including those with developmental disorders and disabilities. The second one is adopts a leading role with children who are at risk of abuse or are being abused, and for those who are looked after and can contribute to the process of adoption. The third one is demonstrates strong skills in working with multiple agencies, particularly with education and social care. The fourth one is actively participates in planning and implementing local strategies to improve the health of all children in their area, including safeguarding policy and overseeing universal and targeted lifestyle programs. And the fifth one is contributes with other professionals to the management of children with life-limiting complex disability.
Yeah, it's quite broad, isn't it?
Yeah, they're very broad. And I think that's probably why there's only 5, because they've swept up a lot in each of those statements, really.
Yeah. So how can trainees sort of gain experience or show interest in community paediatrics?
Whenever I've had my first meeting with an educational supervisor at the start of each job, they always sort of ask what kind of things are you interested in, don't they? It's always worth, if you think you might be interested in community, it's worth saying it. And even if it's not that consultant's special interest, they tend to know what kind of things would be good or point you in the right direction for the right people. So it's worth talking to different consultants that you respect and that you sort of like their career path or something, and finding out what they've done along the way, and see if they've got any particular suggestions, so any sort of projects or teaching. I got involved with doing a communication skills session for safeguarding children with one of the consultants, Emily Payne. And so getting involved with that obviously is added to my CV, and has been something I've been able to talk about at interview and things. Speaking to the right people and getting, because obviously you can do community jobs as an SHO and as part of your level 2 training, so making sure you time those to give you the opportunity to experience them in time for applications is really helpful. So I did a community SHO job. I think I was ST2, I might have been ST3, I can't remember. No, I was ST2. So getting that done early and, realising, yes, this is what I enjoy, meant that I had that early experience and exposure to know what kind of projects and things I should be doing when I'm doing other jobs.
I think if you know that you want to do community early, then any job that you can do can have a bit of a community sort of slant, or the project that you can do. So if, for example, in neonates, obviously as a community paediatrician, you're looking after those after they've been discharged from the special care baby unit. So I think you could probably get sort of community experience from other jobs that aren't actually community, couldn't you?
Yeah, absolutely. When I did neonates, I was telling my consultants I wanted to apply for Community Grid. So we looked at the areas that I needed to work on to build my CV, and sort of management projects, leadership type things. Tried to think about what I could get done whilst I was doing neonates. Trying to go to clinics where they were doing developmental assessments for their NICU graduates, that sort of thing. So yeah, that's absolutely right. I also managed to do palliative care for 4 months prior to one of my maternity leaves, and although that's not community, it obviously ties in really nicely. And I think all sorts of jobs that you can do along the way as some of the specialty choices, you get so many transferable skills that are useful in a career in community child health.
Yeah, and I think it's really important to remember that you don't feel disheartened if you haven't done your core community before you apply, because I hadn't. So, and I was worried about it because I'd only done that ST1 job in community, which, as an ST1, obviously you're just starting out as a PEDS trainee. But actually, I remember in my grid interview about 20 minutes in saying that I hadn't done my core, and the people who were interviewing me were really surprised because they could see how much experience I'd gained in community. And they asked me, how have you gained all this experience? And I just done it, like, as you said, putting a community slant on all the different projects that you do through neonates, through general peds, through peds oncology, whatever it is. And then it's, as you said, Emily, sort of talking to the right people at the right time. Wherever you work, there will be a group of community paediatricians who are very enthusiastic and involved at a high level, and it's getting to chat to them, and they will put you in contact with the right people. So, for example, in Cardiff, we've been very lucky to have a lot of a community paediatric contacts within the sort of research part of Cardiff University. And so that was sort of a nice, easy way really to slide into research and bulking out that box on your grid application. And then it's just about it's networking really, which is essentially all of medicine, isn't it? So going to the batch trainees conference, for example, you don't have to be a community trainee to go there. You can go as a medical student or at any level of medical training, and then chatting to people at that conference, or going to the Imperial College community paediatrics study day that they do twice a year, that is excellent, and just chatting to people at coffee time and lunchtime, and that way hearing about different things that you can get involved in, and obviously gleaning it to the gaps that are on your CV.
One thing I would hugely recommend, which is something that I did not know about before, I think it's quite a new thing that's developed recently, so I didn't know about it before I was doing my grid training, but I found it very, very helpful now, is that there's a couple of neurodisability and community trainees. There's a committee of them being led by two senior trainees, Hannah and Rebecca, who have set up the Neurodisability Community, which is a sort of group that's formed trying to bring trainees together that are interested in either community child health or neurodisability. And it's excellent. And you can join their Trello board, which has got loads of resources on it. It signposts to lots of e-learning and journal articles. And they do lunchtime webinar teaching now since COVID, which is really useful. They do community-based teaching on Mondays and neurodisability-based teaching on Wednesdays. And they're also setting up sort of a research network, so there'd be research opportunities through them, and they have local reps they could put you in touch with as well. So to get in touch with them, if you email the Neurodisability Community at gmail.com, it's all small lowercase, and just tell them that you're interested in joining the community, they would be very happy to have any interested trainees from the very early on in training. They're eager to get people in as early as possible, and that is very helpful. And they're also planning, I know they're planning a webinar on applying to community and neurodisability grid in August as well, which would be another thing that'd be very helpful to anyone thinking of applying to grid. And then I guess the way I found out about them was from attending, as Lizzie was saying, trainee meetings. I found that very useful as somebody who was planning on applying to 3 different grids at one point. I went to the trainee meetings for all the different, I went to the batch trainee meetings and the BACD and the BPNA trainee meetings, and it's very useful to, then you can meet trainees in those areas and chat to them, and then you get a feel for whether that specialty is right for you as well, and make links, and then when you're applying, you can get in touch with them, and people are generally very, very helpful and willing to give you advice. And you can also join the batch, so the British Association of Community Child Health, and then you get their newsletters and things through, and it just makes sure that you're in the loop with things that are going on and new things in community. So that I found that very helpful as well. I joined them just before the interviews, so that I could have a read through their newsletters and things as well.
I didn't know about some of that. Thank you, Siwan. That's really helpful. So shall we move on to actually applying now? Emily, what would your general advice be to trainees who are applying to community?
So if you've made the decision in a good amount of time, then going on the RCPCH website and having a little look at what the grid application form looks like. Technically, they can change the questions every year, but when I've spoken to people previously, the questions are essentially the same year on year. So you can, print that out and have a little look at what different areas you will need to draw from your CV to try and sell yourself. That's something I did. First of all, probably about 18 months before I applied, I started having a little look at it and realising where the sort of bigger gaps were in my application, and then trying to get some more specific things to be able to talk about. So that would be my main tip, really, about looking at the application form early, and then speaking to people. We've said it already about gaining experience and showing interest, but speaking to people who've gone through the grid process, and I know all of us would be happy to speak to anyone who was interested in applying to community child health. So speak to someone directly and get them to have a little chat through maybe your rough ideas for your application form and things, and in plenty of time.
Brilliant, thank you, Emily. What about you, Siwan?
Yeah, so I definitely agree with Emily. There's lots of resources out there on the RCPCH website, and they've got the applicant guide there, which is really useful, and it has all the shortlisting markings on there, so you can identify which areas you maybe wouldn't score as well in, and where you can work on your application, which is very useful. For example, doing GIC or generic instructors course or a teaching course gets you an extra point, so that was something that I did, which was very useful. And then reading through the subspecialty curriculums as well is something I did, and then tried to identify any areas where I didn't have much experience, and then arrange some tasters in those areas as well, so that when I went to interview, I had more of a well-rounded understanding of the specialty, and been to different specialty clinics. So I went to sort of learning disability CAMS clinics, and I arranged. You can also look at the programs are all published on the RCPCH website, so you can find out who the supervisors are for the different programs, and you can email them if you're interested and ask if you can do a taster and go to some clinics with them as well, to find out what the program's likely to be like. I guess the main thing is to leave enough time to fill that form out, so that even though it looks fairly short, I'm sure Emily and Lizzie would agree. I don't know if the form's changed since you filled it in, Lizzie, but it does take a lot of time to fill that out. So making sure that you start early, so that then you have time to get other people to read through it and proofread it, rather than leaving it all to the last minute. It takes a lot more time than you think. Anything else? I think, in terms of other things you can do to sort of maximize your score, I think the reassuring thing I realized when I was filling in my application is that you don't need 100 different quality improvement projects and audits. You only need one or two very good quality ones. So rather than focusing on doing lots and lots of different projects and getting involved in lots of things, it's better off just to focus on getting one project finished properly, going through the whole audit cycle, and that scores you more points than it would to have done sort of partially or started lots of different projects but not finished anything.
I think that's really important, Siwan, actually, isn't it? Thinking about how you can maximise from one project, what can you get out of it, and when you're agreeing to do a project, or when you're choosing a project, pick things that are going to help you. So I think early on in my training, I just kind of plodded along and did various little things, but further through my training, I've said no to things that I thought would be using up a lot of my time, but not actually boosting the area of my CV that I wanted to focus on at that particular time, and sort of being realistic about what I could achieve in the time that I had.
Yeah, I completely agree with that. I think it's about making the most of everything you do, whether it's an audit, whether it's a project, whether it's getting involved in a committee, there's no point, you don't really get many points for just having been on a committee, or just having sat on the STC, for example. What you get points for is showing that you have identified a need, worked out how to address that, and then addressed it. So very much in the same way of as completing the audit cycle. So it's about taking a very active, proactive part in whatever it is you do, and milking it for all you can get, really. So don't let those projects just sit on the side, because I know I say this whenever I get asked, but it's amazing what gets accepted. And I think we always, we're quite sort of naturally humble people in medicine, and we always think, oh, our project's not adequate enough. There's no point in trying to submit something, but actually there absolutely is. Try and submit everything and get a publication or a presentation out of it. And one of the things I found when I was going through the grid application, which, as you said, it hasn't, it's the same every year, essentially, the questions. I found that there were some boxes, for example, about talk about a project where, patient-centered care, that sort of thing. And I was thinking, oh gosh, I can't think of what I've done for that. And then when I actually looked back through my e-portfolio, I found several projects that had been very much about that. But because we're, obviously constantly moving on through placements and having to do audits and projects every 6 months, it's easy to forget what you did at the beginning of your training, and that those projects are no less valid because they were a few years old, especially if you've done them well and made the most out of them. So it's about really looking back through your portfolio and your career and remembering the projects you did, and how you can sway them to fit into the different boxes. And the other thing I would say is, as Emily said, it is so much about selling yourself, and we are just generally quite rubbish at doing that. We think that people know what we do, but of course the people who are marking these applications and who are interviewing us, usually we don't know them. So unless you say it or write it, they don't know that you've done it. So you have to say it. And I found that very uncomfortable initially in writing my application, because it doesn't come naturally to us. But if you don't say it,
it's quite a different mindset change, Lizzie, isn't it? You have to really change the way you think about yourself and the things you're doing.
Definitely.
The way you write it has to sell yourself to somebody who's never met you before.
Yeah.
I actually found going through, initially I was panicked. I haven't got enough time. I can't get any points on this application form at all. Like, what on earth am I going to do? But as Lizzie said, once I went through my portfolio and picked out key things, wrote down all the different things that I'd done, it's actually quite satisfying to see what you have done. I chatted to a couple of colleagues, and they were, when I said, well, I haven't got anything for management, nothing at all, and they were like, well, don't be silly, I'm sure you do. And then when they gave examples of things that they had, I was like, oh yeah, I did that. Oh yes, I've done that too. Yes, I've got that. It's like, oh, okay, I could put that on there. That's great. So it's quite rewarding then to look back at your career and see what you have achieved.
Yeah, it's a good point. Another really good tip that somebody gave me when I was applying, that I didn't know, possibly everybody else knows, I was the only one who didn't, but when you present at a conference, often there is a publication that goes alongside it. So it might just be your abstract, but it will have been published in the Associated Journal, and you can reference that on the form.
Thank you all so much for your fantastic insight and advice you gave us there. We will be getting out the advice for improving your interview technique for community grid applications soon. Thank you for listening to Dragon Bites.